Let's move quickly through transition and take some questions. So the life expectancy has gone up. Previously in our center, we did a very poor job of transitioning our patients. Patients were said to congratulate or be graduation when they exhibited adult behaviors. And this was kind of like graduating to the cliff's edge. And this was a free fall disaster, both for patients and for families. And at UAB, we weren't alone. These patients were terrified. These families were terrified. The adult providers were not welcoming. They didn't want to receive a bunch of brittle shunt complex patients that had continence challenges and long-standing relationships with other care teams. So this was really, really difficult. The patients were challenging. Many of them had some neurocognitive delays, helicopter parents, long-standing relationships with prior providers. And so this was a disaster on both sides. So we worked at UAB to develop a transition program. It has multiple parts to it. We started doing our program about 12 years ago. It involves all parts of our academic medical center, and basically involves a pediatric side, this is the same sheet of paper, the red and white, and the adult side, which is the green and white, reflecting the colors of the two institutions. This was where we started, and we did some work looking at the quality of life of children with spina bifida, and I'm going to skip the details of this for time's sake. But we did make some important observations about transitioning children. Transition is an important concept across medicine. It's not just neurosurgery, not just medicine, but surgical disciplines are increasingly paying attention to it, and it is an important area. It is an underserved area. There is a pronounced call for action for the development of adult programs, and I hope that where you are, you will prompt your teams and ask the question about how adult care is being provided and why there's not an adult program and why there's not a transitional program. Because there are many, many people with transitional needs, neurosurgery, spina bifida, and many, many others. So we initially worked on our program and we thought, well, we've got this down, and then we did these quality of life assessments and we were very disappointed. And we came to realize that transition is as much about a process as it is about a facility. Transition in an adult clinic isn't about a building or a clinic space. It's not about an individual provider. It's about a process where it's a system of connection and communication that starts with the family and preparation for transition, which starts very, very early on in the process. Neurosurgical needs decrease in the adult community. Bowel needs, depression, and urology evolve to the forefront, but neurosurgery still needs to be there. We need to be there to provide the presence and the support that if those shunt problems, tethered cord problems, and things like that act up, that we have the interest and the competence to support them. But just because they're not front and center doesn't mean we've lost interest in the patient. So we do our spina bifida clinic about twice a month. Ours has resulted in something called the Individual Transition Program, which is a codified specific program put together between the family and the care providers to help maximize education and develop both education and a bowel program, which were the two factors shown in our clinic's early experience to predict good clinical outcome. So transition needs to be individualized. It involves more than a location, and communication lines need to stay open.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.